Hi guys, hope you're keeping well. Dr. Sander here from iMedics. Just thought I'd do a nice short video for you on the condition Tetralogy of Fallot. It's a very common question that comes up in exams and also useful to know for clinical exams as well. There's certain things that patients will mention or the clinical question will mention, and if you can pick up on these cues, you're more likely to get the correct diagnosis. So the first things first, Tetralogy of Fallot is the commonest congenital cyanotic heart condition. So it's for that reason we should be aware of it. And the degree of the symptoms will depend on the degree of pulmonary stenosis. So we made a fantastic Instagram learning card with the mnemonic PROVE so that you can remember the key features of Tetralogy of Fallot, which is a very common exam question. The P stands for pulmonary stenosis, the R stands for right ventricular hypertrophy, the O stands for an overriding aorta, and then you've got the VE, which is for the ventricular septal defect, and that gives you the mnemonic PROVE. They are the key features of Tetralogy of Fallot. Explaining them in more detail, it does make sense. So if you think that the pulmonary vessel is stenosed, the right ventricle has to work harder to try and pump the blood through that stenosed vessel. And so what happens? We get right ventricular hypertrophy and we get a characteristic right to left shunt. So the deoxygenated blood is pushed to the left side because it can't get through that stenosed vessel. And that leaves us with deoxygenated blood being pumped from the left side of the body to the rest of the body. And so we get cyanosis. The other thing to bear in mind is that the symptoms can vary depending on the degree of pulmonary stenosis. So if it's mild pulmonary stenosis, you may only notice an ejection systolic murmur in an older child. Whereas if there's more severe cyanosis, or severe stenosis rather, you'll get more obvious cyanosis, more obvious breathing difficulties, but also some children may get what we call hypercyanotic spells, whereby they squat down and their cyanosis improves, and that's because they have a reversal of the shunt. So the squatting down will increase the pressure on the left side of the heart, and that will reverse that right to left shunt to a left to right shunt. So now you have oxygenated blood going back the other way, and that can bring some relief to the patient. So that's an important thing to be mindful of in the exam questions. In terms of the investigations for this, well, cardiologists, of course, have a range of investigations that they do, but we always go for the common things are commonly done. So things like an ECG, which will show right bundle branch block, and the chest x-ray, which can be normal, but you may also get what we call a classic boot-shaped heart. So it looks like a big leather boot. And that's a classic feature that they test in the exams. If they mention a boot-shaped heart, the most likely diagnosis will be a Tetralogy of Fallot. So it's important to be mindful of that. In terms of managing it, it's surgical management. So it needs to be managed as quickly as possible with surgical correction of the underlying abnormalities. And that's a short video on Tetralogy of Fallot. I hope you found it useful.